I want to talk to you about what are the causes of obstructive sleep apnea in children. First of all, the more common cause of obstructive sleep apnea is typically the adenoids and tonsils being enlarged. By far, this would be the first line of therapy for most children with obstructive sleep apnea. Approximately 80% of children who have large tonsils and adenoids and have obstructive sleep apnea would experience a significant improvement and likely resolution of the obstructive sleep apnea. Unfortunately, that's not all the children, and there are other conditions that also play a role. And in this assessment, there are different tools that we have to determine what else could possibly be obstructing. These tools include things like sleep endoscopy. Sleep endoscopy is a procedure that allows the child to go under some form of anesthesia to go to sleep. And when the child is breathing dynamically during sleep in an operating room-like setting where their airway is closely monitored, we can introduce a small camera into the airway, through the nose usually, and view the areas of obstruction. And this defines areas of tongue base obstruction. Sometimes the tonsils that grow on the back of the tongue, called the lingual tonsils, are enlarged and contribute to obstruction. Laryngomalacia. This is another newly diagnosed, newly understood condition in children where you see that dynamic obstructions in the level of the larynx or the voice box can sometimes contribute significant to sleep apnea. Also, palatal obstructions. Some children have a soft palate that tends to also dynamically obstruct the airway. Some children have, unfortunately, more global obstructions, where the lateral walls of the airway, the whole airway just moves too dynamically. Their airway becomes too floppy. That's often seen in syndromes, in conditions where the child doesn't have normal muscle tone. We can treat some of these conditions. Unfortunately, we can't treat all of them surgically. And the assessment of what is causing the obstructive breathing during sleep is very important to determine a management plan and effectively treat the condition.